So next, let's start with the immunity. So under immunity, we'll be discussing the various cells of the immune system. Then how does this immune system get activated? Then we'll see about major histocompatibility complex, hypersensitivity reactions, tolerance. Then the failure of which is going to cause autoimmune diseases. Then we'll see about the immunodeficiency diseases, amyloidosis, and transplant versus graft pathology. So starting with the cells of the immune system. So all of the immune cells will be arising from the hematopoietic stem cells. So the hematopoietic stem cell is going to produce both the myeloid progenitor cells and the lymphoid progenitor cells. So the myeloid progenitor cells will in turn give rise to the erythroid, megakaryocyte and the granulocytic cells, while the lymphoid progenitor cells is going to give rise to the B cells, NK cells and T cells. Okay, so the hematopoietic stem cell is going to have a positivity for CD34. So the marker of hematopoietic stem cell will be CD34. So this is again a question which has been asked. So whenever this lymphoid progenitor cells undergoes a transcription with the help of this PAX5, E to F and EBF, these factors, it is going to give rise into the B cells. While if the notch transcription factors are being there, it is going to transform into a T cell. Okay, so this NK cell is also called as a large granular lymphocytes, and this NK cells are going to be a part of the innate immunity. So let's start with the B cells first. So the B cells are going to compose 20 to 30% of the lymphocytes of the body. So the majority of the lymphocytes are going to be composed by the T cells actually. So B cells compose 20 to 30%, and these B cells are formed and matured. Both formation and maturation of this B cell is going to take place in the bone marrow. Okay. So bone marrow is the site where B cells are being produced and they mature in the bone marrow again. And these B cells are localized at various lymphoid tissues in the body. So in the lymph nodes, they are going to be present at the follicles. Okay. So the follicles are the ones wherein the B cells are present in the lymph nodes. In the spleen, it is going to present in the white pulp, where again it forms the follicles. In GIT, it is going to be present in the mall tissue. Okay, mucosa associated lymphoid tissue is small tissue. So there again you see this B cells. You can also see B cells in other lymphoid tissues like tonsils. So what is the structure of this B cell receptor? Okay, so normally any antigen which is going to be present, it is going to bind to a receptor on the B cells. So B cell is also a antigen presenting cell, meaning it takes up this antigen and it is going to process it and present it to the T cell so that immune system can get activated. Okay, so the receptor in which to which this antigen is attaching to this B cell is called as a B cell receptor, and this B cell receptor is composed of IgM and IgD. Okay, so B cell receptor is composed of immunoglobulin M and IgD. So this again is a question, and this B cell receptor is going to be associated with two subunits, which is CD79A and CD79B. So CD79A and B are also called as Ig alpha and Ig beta. So the CD79A and B are also markers of the B cell receptors. So what are the various CD markers? So CD markers are nothing but cluster of differentiation. So there are specific CD markers expressed by specific cells. So in order to classify it as a B cell, you need specific CD markers to prove its origin. So what are the CD markers which are expressed by the B cells? Let's see. So starting with CD10. So CD10 is also called as CALA antigen. So CALA stands for common ALL antigen. So common ALL antigen, it is going to be a early precursor marker of B cells. So precursor B cells are going to express this CD10. Also CD10 is going to be expressed by cells which are present in the germinal center, which are again precursor cells. Okay, so CD10 is a marker of precursor B cells and also a marker of the germinal centers of the lymph nodes. So CD19 is going to be called as the pan B cell marker. Okay, what is the pan B cell marker? CD19. So CD19 is the pan B cell marker. Apart from that, we also have CD20, CD22, CD23 markers expressed by these B cells. Then there is a CD21 marker again. CD21 marker is also called as complement receptor 2. So CR2 is complement receptor 2, and with the help of this complement receptor 2 or the CD21 marker is the one with which the Epstein-Barr virus is going to attach itself. Okay, so the receptor for Epstein-Barr virus is going to be present on the B cells, which is nothing but the complement receptor 2 or the CD21 marker. Then we have this CD40 CD marker. So CD40 is again present on the B cell. This CD40 is going to bind with the CD40 ligand present on the T cells. Okay, the ligand is present on the T cells. So the interaction of the CD40 with the CD40 ligand on T cell is going to cause the B cell activation. Okay, only when this interaction happens between the B and T cells, the B cells are going to get activated. Then there is another interaction between the T cell and B cell, which is the CD80 bar 86. So CD80 bar 86 is going to be present on the B cells. So this is going to attach with the CD28, which is present on the T cells. So this interaction will in turn lead to the activation of T cells. So this is very important. So remember, CD40 ligand interaction will result in the B cell activation, while CD8086 with the CD28 interaction is going to result in the T cell activation. So what is the role of B cells? So initially also I mentioned B cell is going to be an antigen presenting cell. Apart from that, the B cells are going to produce immunoglobulins. This immunoglobulins is a part of this adaptive immunity. So B cells will differentiate into the terminally differentiated B cells, which are plasma cells. So the plasma cells are the one which produce the immunoglobulins. So the structure of an immunoglobulin is going to be like this. So this part is going to be called as the light chain, while this center part is going to be called as the heavy chain. So based on the light chain and heavy chain, we have two subtypes. So the light chain is going to be either a kappa light chain or a lambda light chain, while heavy chain is going to be either a alpha, beta, mu, gamma or epsilon. Okay. So based on that, we have Ig, G, IgA, IgM, IgD and IgE. So it is actually, remember it in this order only, because the IgG is the immunoglobulin present in the maximum concentration. Next comes IgA, and the least common one is the IgE. Okay, so GAMD is the mnemonic to remember this. So IgA, M, D and E is based on the heavy chain. We are classifying this immunoglobulins, and then this side of the immunoglobulin is the one wherein the antigen is going to attach. So it is called as the FAB. FAB region is going to be the antigen binding site of the antibody, while this region is the one which attaches with the complement. So it is going to be called as the FC receptor, FC portion of the immunoglobulin. So there are WBCs which have this receptors for this FC part. So FC receptors will be expressed by WBCs. So this FC part of the immunoglobulin is going to attach with the FC receptors present on WBCs, and that will result in the complement activation again. Okay, so that we'll be seeing later on. So now let's see about the various immunoglobulins. So first one will be the immunoglobulin G. IgG is the immunoglobulin present in the maximum concentration. That is why we are telling it at the first. And then this is the antibody which is present in the secondary immune response. So initially when the immunoglobulin, the first immunoglobulin to be responding to an antigen will be a IgM. So secondly, we'll have this IgG which has a longer immunity. So it is a persistent and a stronger immunity is going to be present. So IgG is the one which persists for life. So this IgG has a specific property which is crossing of the placenta. So IgG immunoglobulins can cross the placenta, and that is why in RHD, that is RH incompatibility, so hemolytic disease of the newborn, HDN we call it, right? So in HDN we have antibodies crossing from the mother to the through the placenta to the fetus, and in the fetus it is going to cause hemolytic disease. So that is because the antibodies which are crossing is going to be IgG. Okay, so in those of this IgG again are classified into subtypes like IgG1, G2, G3 and G4, and based on their placental crossing ability, this IgG1 has the maximum ability to cross the placenta. Next comes G3, then G4, then G2. Okay, then both IgM and IgG is capable of activating the classical complement pathway. So in the complement pathway, we have three pathways, right? Classical pathway, alternate pathway and the lectin pathway. So IgG and M will activate the classical pathway, while IgA can activate the alternate complement pathway. So next comes the IgA. So IgA is a part of the mucosal immunity. So it is going to be present in the secretions, saliva and the mucosa. Okay. So in the gut, GIT, it is going to be present mainly. So in the serum and secretions, this IgA is the present at maximum concentration, and it is responsible for the mucosal immunity, and it can activate the alternate complement pathway as I mentioned. So A for A, remember it like that. Then comes IgM. So IgM has the maximum size. So it is going to be a pentamer actually. Pentamer as such, it means, so if this one immunoglobulin structure is going to be like this. So there are going to be 5 immunoglobulins attached like this. So that is why it is going to be called as a pentamer. Okay, it's a pentamer and it has the maximum molecular weight and the maximum size. Okay, and since it is having 5, it is a pentamer, it has the maximum immunoglobulin binding sites as well. So all of these sites you can have the antigen binding. So it is going to be having the maximum antigen binding sites as well. Then, as I mentioned, it can also activate the classical complement pathway. Then IgM is the primary immune response. So the secondary immune response was IgG, while primary was IgM. Then coming to IgD, so both IgM and IgD were actually part of the B cell receptor. Okay. Then IgE, so it is the immunoglobulin present in the least concentration. And then IgE is going to be involved in the primary type 1 hypersensitivity reactions. Okay, so allergic reactions, therein we are going to have this IgE mediated responses. Okay, so allergy is an example of type 1 hypersensitivity wherein you can have this IgE mediated response. So based on the type of the antigen, the immune response is going to vary. So most of the antigens are going to be proteinaceous antigen, but some of the antigens can be non-proteinaceous. Okay, but normally proteinaceous antigens are going to have a T cell dependent response. That is, it is going to involve T cells. So what happens in this is, when an antigen, which is a proteinaceous antigen, is going to bind with a B cell receptor or any antigen presenting cell. Okay, so these antigen presenting cells are going to process the antigen and then present it along with the MHC, which is a major histocompatibility complex. So with the help of this MHC, it is going to present it to a T cell. So this T cell will then again take up this antigen. So T cell will have again T cell receptors. So let's take the example of a antigen presenting cell as a B cell. Okay, so the B cell, which is an antigen presenting cell, is going to present a antigen to the T cell with the help of the T cell receptor. So now there is going to be 3 kind of interactions. Firstly, the B cell receptor, which along with the not the B cell receptor. So the MHC complex will present with to the T cell. So that is the T cell receptor. So that is the primary interaction which is going to take place. So first interaction is between the MHC complex of the antigen presenting cell with the T cell receptor. The second reaction will be a CD4 T ligand, which is present on the T cell interacting with the CD4 T present on the B cell. So that will result in the B cell activation. Thirdly, we have a co-stimulatory signal, which is CD80 or 86 present on the B cell is going to interact with the CD28 present on the T cell. So this interaction is called as the co-stimulatory signal, which is going to activate the T cell. So 3 interactions is going to be present when a B cell and T cell is having an interaction. Okay. So when this interaction happens, the T cell is going to get activated and T cell is going to release certain interleukins, out of which this interleukin 4 is very important. So interleukin 4 is going to be a interleukin which is produced by the subtype of T lymphocytes called as CD4 Th2 lymphocytes. It's a subset of helper T cells. Okay, so this Th2 is going to produce this interleukin 4. This interleukin 4 is responsible for the activation of the B cells into plasma cells, and these plasma cells will in turn produce immunoglobulins. So for the production of immunoglobulins, we need this interleukin 4. Okay, it's very important. Interleukin 4 is needed for the immunoglobulin production, that is activation of the terminally differentiated B cells. And this interleukin 4 is also needed for isotype switching. That is basically whenever, suppose a helminthic antigen has come. Helminth is a parasite, right? So helminthic antigen has come. So the body will initially produce immunoglobulin M. but later on it has to switch to a IgE. So we all know that any parasitic infections, it is going to be IgE which is going to respond. So this IgM has to get converted into an IgE. That specific type of antibody has to be present. So this kind of IgM switching to other kind of antibodies is called as isotype class switching. Okay, so this isotype class switching, for that we need this interleukin 4 again. So this isotype class switching is very important because they are producing specific antibodies to the antigen. So this is also called as affinity maturation. Suppose there is a suppose this is an antigen which has a many parts, right? So against a specific part of this antigen, there is going to be specific antibody going to be produced. How does that happen? It is because of this process of affinity maturation. So specifically, they are going to produce antibodies for the specific antigens. So this kind of production is called as affinity maturation. So both this isotype switching and affinity maturation are very important for a potent immune response. Okay, so this kind of isotype switching and affinity maturation will happen only when interleukin 4 produced by the T cells is present. So, T cell dependent immune response is the strongest immune response. Understood? So, proteinaceous antigens is going to produce a T cell dependent immune response, which is going to activate the B cells to cause isotype class switching and affinity maturation. Why is it important? Because this type of immunity is going to have a lot of memory. So, memory is needed for a long time persistent immunity against the same antigen, right? So, this type of T cell dependent response has the maximum potency and the memory. Let's move on to the non-proteinaceous antigens. So, a non-proteinaceous antigen will not stimulate a T cell. It is going to directly stimulate the B cell receptor and produce immunoglobulin M. Okay, so IgM alone will be produced. So, there is not going to be any isotype class switching. So, there is not going to be any other IgM productions, any other immunoglobulin productions. So, only IgM is produced, and it is basically a very less potent and less memory kind of a immune response. So, it is a less potency. So, we need proteinaceous antigens to produce immune response which is highly potent. So, this is a summary I have already mentioned. So, this is the B cell here. So, this is the B cell, which is again a antigen presenting cell, right? So, this B cell is going to process the antigen, and it is going to take up the antigen with the help of the B cell receptor, and then it will process it and present it to the T cell receptor with the help of MHC complexes. So, with the help of MHC, there is going to be interaction between the MHC molecule with the T cell receptor, and then there is also going to be interaction between the CD4 T and CD4 T ligand. So, this is the first interaction. This is the second interaction. Also, there is going to be a third interaction, which is CD80/86 present on the B cell interacting with the CD28 present on the T cell. So, this is the third interaction. So, the second interaction is going to cause B cell activation, while the third interaction, which is the co-stimulatory signal, is going to cause the T cell activation. So, when T cells are activated, they are going to produce this interleukins, interleukin 4, interferon gamma. So, interferon gamma is going to be produced by the T helper 1 subset, while interleukin 4 is going to be produced by the T helper 2 subset. Interleukin 4 was the one responsible for final maturation of the B cell into plasma cell, producing the various kinds of immunoglobulin, isotype, class switching, and affinity maturation. So, let's move on to the T cells now. So, as I mentioned already, it is going to be the maximum amount of T cell, maximum amount of lymphocytes is going to be T cells, which is 60 to 70%. Here, the formation of the T cells is going to be same as that of a B cell, that is in the bone marrow only, but the final maturation of T cell is going to happen in a thymus. While in B cells, both maturation and the formation was in bone marrow, for T cells, maturation is going to happen in the thymus. In the lymph node, the T cells are going to be present in the paracortex. Okay, so surrounding the follicles, we have the paracortex. So that is where the T cells are going to be present. In the spleen, it is going to be present in the periarteriolar lymphoid sheath. So, in the lymphoid follicles of the spleen, you have a central arteriole, right? Eccentric arteriole. So, around the eccentric arteriole, you have a lymphocyte sheath, which is going to be composed of the T cells predominantly. Also, it is this T cells again present in the GIT and tonsils again. So, the structure of a T cell receptor is going to be either a alpha beta subunit or a gamma delta subunit. But this alpha beta subunit is going to be the most common one. Okay, so the B cell receptor was composed of IgM and IgD, while T cell receptors most commonly is going to be composed of the alpha beta subunit. So let's see about the various CD markers expressed by these T cells. So we have the T cell markers which are CD1, 2, 3, 4, 5, 7, 8. So starting numbers except 6 you can write. Then CD28, CD40 ligand. So out of this CD3 is going to be the pan T cell marker. So what was the pan B cell marker? It was CD19, while pan T cell marker is going to be CD3. And the CD3 is going to be associated with the T cell receptor. So we have this alpha beta subunit, right? It is going to be associated with this CD3. Okay. Then we have CD4, which is going to be expressed by a specific subtype of T cells called as the T helper cells. The helper subsets of T cells are going to express the CD4, while CD8 is going to be expressed by the cytotoxic T cells. We have two major classes of T cells, helper cells and cytotoxic cells. Helper cells will express CD4, while cytotoxic cells are going to express CD8. Then we have the CD28, which is again going to interact with the CD80 bar 86, and this is going to be present on the B cells, and this is called as the co-stimulatory signal, right? Co-stimulatory signal will result in the activation of T cells. Then again, we saw CD40 ligand is going to be present on the T cells, which is going to interact with the CD40 present on the B cells, and that will result in the B cell activation. So far clear, right? So let's see about the type of T cells. I've already mentioned CD4 type of T helper cells and CD8 positive cytotoxic T cells. So as the name suggests, CD4 positive helper cells. So these are going to help. So what are they helping to? They are going to help in the immune responses. And CD8 positive cytotoxic T cells. So cytotoxic, as the name mentioned, it is going to be killing some of the cells. So this is for killing and this is for helping. So let's see about the CD4 helper T cells first. So this is going to be the master regulator of immune system because it is going to regulate, it is going to help various parts of the immunity. So firstly, it is going to interact with MHC2. Okay, very, very important. CD4 T cells will interact only with MHC2. Okay, while CD8 positive T cells, cytotoxic T cells will interact with MHC1. Okay, so remember, 2 4s are 8, so it is going to be MHC2. So when this MHC2 is going to be present on the antigen presenting cells. So MHC2 is going to be present on antigen presenting cells. That is why it is going to interact with the T cells, right? T cell receptor, that interaction which we are speaking about now. So that reaction will happen when MHC2 is going to be present on the antigen presenting cells. So that will result in the CD4 T cell activation. When T cells are getting activated, CD4 T cells are getting activated, it will transform into 3 types of CD4 positive T cells, which are subset 1, subset 2 and subset 17. So we represent it as T helper 1, T helper 2, TH1, TH2 and TH17. So this is going to be based on the specific transcription factors. So we will not go into that much detail. So when CD4 positive T cells are getting activated into TH1 subset, they are going to produce interleukin 2, interleukin 12 and interferon gamma. These interleukins are quite specific, so you'll have to remember it. So TH1 will produce interleukin 2, which is actually a autocrine interleukin. Basically, in TH1 subset will produce interleukin 2, which will again activate the T cells to produce more T cells. So it has an autocrine effect. Then we have interleukin 2 and interferon gamma. Interferon gamma, we have already seen, it is the one which is responsible for the granuloma formation, right? So it will go into activate the macrophages and produce the granulomas. Then we have TH2 subset, which is going to produce 3 interleukins again, interleukin 4, 5 and 13. So 4 already we had seen, it is responsible for the maturation of B cells into plasma cells to produce immunoglobulins. And it is responsible for isotype class switching as well. So interleukin 4 is needed. Then interleukin 5 is going to be for eosinophil activation. So eosinophil activation is going to take place when interleukin 5 stimulation is present. Then we have interleukin 13. We all know it is going to be an anti-inflammatory cytokine, right? Anti-inflammatory cytokines like interleukin 6, 10, 13, TGF-beta. So 13 is an anti-inflammatory cytokine produced by Th2 subset. Then we have Th17 subset which produces interleukin 17 and interleukin 22. So interleukin 17 is going to recruit neutrophils and monocytes. So this again we had seen in inflammation. Okay. So far we had seen about the CD4 Th cell, the helper T cells. Then we'll see about CD8 positive cytotoxic T cells. So as I mentioned, it is going to be cytotoxic to some cells. So it is going to be responsible for the killing of virus and tumor cells. Okay. The major killing of virus and T cells will be basically by two cells. Firstly, it is a CD8 positive cytotoxic T cell. Another one is a NK cell. So both these cells are responsible for killing the tumor cells and the virus infected cells. Okay. So CD8 positive T cells are going to get activated only when they react with the MHC class 1 molecule. Okay. Then the mechanism of killing of this cytotoxic T cell is by two pathways. Firstly, we have a perforin granzyme pathway. Then we have a fast cell pathway. So this perforin granzyme enzyme is a enzyme complex present in this CD8 positive T cells. So this perforin, as the name suggests, is going to perforate the cell membrane. So suppose there is a virus infected cell or a tumor cell, it is going to perforate this cell membrane of the infected cell. Okay, so perforin is going to cause the perforation. Then the granzyme is the enzyme which is going to be having two subunits. So this granzyme is the one which is responsible for killing. So this A subunit is going to produce the reactive oxygen species. So that again is going to cause the damage to the virus infected cell. And then B subunit is going to activate the caspases. So caspase activation is going to take place. So caspase, whenever it is activated, now it is going to cause apoptosis. Okay. So cytotoxic T cells are going to kill the cells with the help of apoptosis. Then again they have a fast cell pathway, which again we know fast is going to be present on the target cells. So whichever cell is going to be killed, virus infected cell or a tumor cell, it is going to produce fast, and then this fast L is going to be present on the cytotoxic T cell. So when this interaction takes place, it is going to result in the apoptosis of the target cell. So this cytotoxic T cell involves killing by apoptosis method. So this fast cell pathway was the extrinsic pathway of the apoptosis, remember. So both the perforin granzyme and the fast cell pathway is going to involve the apoptotic pathway to kill the cells. So now we had seen about the two main sets of the T cells. There is another subset of CD4 T cells only, which is called as T regulatory cells. So as the name suggests, it is going to regulate the immune system. So it is one of the most important cells which is responsible for controlling the immune system. So whenever there is an immune response, so once the offending agent has been removed, it has to subside. The immune system has to come back to its normalcy. So this kind of regulation is going to be controlled by the T regulatory cells. Also, these T regulatory cells are going to play an important role in preventing the body's own immune system to act against the self antigens. So to prevent autoimmunity also, Treg cells are very important. So as I mentioned, it is going to be a subset of CD4 T cells. So Treg cells will be CD4 positive. Also, they are positive for CD25 and FOXP3. Okay. So these three things are very important for Treg cells: CD4 positive, CD25 positivity, and FOXP3. So FOXP3 is a transcription factor. Only when FOXP3 is present, in response to the FOXP3 only, this Treg cells are produced. So T cell activation, I have already mentioned. Again, a diagrammatic representation I am telling. So this is the antigen presenting cell, which again could be a macrophage or a B cell. It is going to have present the antigen in context with that of a MHC molecule. And this, with the help of this MHC molecule, it is presenting to the T cell receptor, which is going to be the alpha beta subunit most commonly. So this T cell is going to take up this antigen, and then this is the first signal. Second signal, which was the co-stimulatory signal, is the CD86 with the CD28. Okay, this will result in the T cell activation. Now T cells are going to produce interleukins to activate the B cells. Okay, so both the signals, with one signal it is not going to activate the T cells. So both the signals are needed for the T cell activation or B cell activation. So extra edge I'll be discussing here. So there is something called as a super antigen. So far if you had seen, I was drawing the antigen here the blue color here. So it was the antigen was presented to the T cell with the help of this MHC complex in the center. But there are certain antigens called as super antigens, which are actually binding to the alpha chain of the MHC2 molecule. So they are going to be present on the side of this MHC. So when these bind here to this alpha 1 chain of the MHC2, it is going to result in massive release of cytokines. So lots and lots of cytokines are going to be released. It is going to cause lots of complications. So the patient usually goes in for a shock because of the inflammatory response. So the best example of the super antigen involved disease will be a staphylococcal toxic shock syndrome. So TSS, STSS we call it, right? So STSS is the one in which we have this super antigen activation. Then the third cell was the NK cell, remember? So NK cell, I mentioned, it is the large granular lymphocyte, and here it is a part of the innate immunity, and it doesn't have any MHC restriction. That is, it doesn't need any interaction with the MHC to get activated. So it is also called as a MHE unrestricted cell. Then it composes 5 to 10% of the lymphocytes only, and here it is going to kill the virus infected cells and tumor cells, the same function as that of a cytotoxic CD8 positive T cell. So what are the CD markers expressed by these NK cells? Again, very, very important. These are going to express CD16 and CD56. So this CD16 is going to be present on this NK cell. This is going to interact with the FC portion of the immunoglobulin. So this immunoglobulin has attached with the antigen and has formed the immune complex. So this immune complex, so this part of this of the immunoglobulin was called as the FC portion, remember? So this FC portion can either attach with the CD16 of NK cell and cause NK cell activation, or it can attach with the FC receptor present on WBCs and cause complement activation. So CD16 is going to be present on NK cells. It is going to interact with the FC portion of the antigen antibody complex. So there are two kind of receptors present on the NK cell. First will be a co-stimulatory or a stimulatory receptor. Second is an inhibitory receptor. Suppose a virus infected or a tumor cell is coming, then it is going to have some antigen which is going to interact with the stimulatory receptor present on the NK cell, resulting in the killing of this tumor cell. So what is the stimulatory receptor? We have this NKG2D receptor. So NKG2D receptor is the stimulatory receptor present on the NK cell, which is causing the killing. Then we have the inhibitory receptor. That is, if suppose a normal cell is coming, it is going to express a MHC molecule. So whenever there is an MHC molecule associated, it is going to come and interact with this inhibitory receptor, and that so that this NK cell doesn't kill the normal self antigen. Okay, so this is why there is an inhibitory receptor present on the NK cell.